you, Honourable Speaker. Thank Honourable Tudol for his question. In terms of the updates, Parliament on the St Giles Psychiatric Hospital facelift and upgrade. Just by way of context, St Giles Hospital is one of the oldest hospitals in Fiji. It has been in services since 1884. Again, it has lived through many climatic and operational challenges, and the current infrastructure has undergone significant wear and tear over the years, with the increasing in service demands, with an increasing number of patients of all ages are seen, treated, admitted, and followed up at the hospital. And place a considerable demand on the infrastructure. Patients seen at the hospital range from acute to chronic psychiatric illness, substance abuse, and forensic psychiatric cases, and the infrastructural works have been done over the years to cater for changing demand and patient demographics hospital. It is also has been a tertiary care training hospital for many years through Fiji's Medical School and now FNU. And in the last 2 years, Honourable Speaker, while working with our development partners and through budgetary allocation,
still continuing. Please switch off your cell phone.
Sorry, Honourable Speaker. Our health partners and development partners have come on board to assist us with the women's ward, the Moala ward, and the admin building that have been renovated and now occupied. Another significant works completed involve the tar sealing of the roads and car park inside the hospital premises, which cost over 235,000 Fiji dollars. And the road had not been repaired for a number of years, causing not only discomfort to passengers and damage to the vehicles, but also to the staff who work and live within the vicinity of St Giles Hospital. Earlier this year, the Ministry constructed a new fence behind the men's ward, costing around 32,000 to improve the security of the admission facility, as was highlighted in the media. And in this financial year, the Ministry has also allocated funding to the minor works allocation for further repair and renovation works at the hospital. In addition, constant development and advancement of medicine worldwide, the Ministry is approaching partners and donors organizations for the possibility of assisting towards the establishment of a new facility, Honourable Speaker, that will allow the hospital to venture into the latest treatment modalities, elevating mental health services in the country. Mr. Speaker, a new facility will allow hospital to branch out into the fields of addiction psychiatry, child and adolescent psychiatry, and old age psychiatry, and to deliver specialist services such as group therapy, psychodrama, lithium level testing, recurrent transcranial magnetic stimulation, electroconvulsive therapy, or ECT as it's commonly known, and telepsychiatry. Again, government is remain committed to addressing mental health in the country and improving the mental health services to our people. Thank you, Honourable Speaker.